I'm Lauren Schuster, and you're watching Medically Speaking on Fox Wilmington. 3 critical components of healthcare that underserved communities traditionally lack are knowledge of healthcare, access to facilities like this, and health insurance. And Novant Health Michael Jordan Family Medical Clinic aim to reduce those barriers. I'm here with Nick Green, the clinic administrator. And now, Nick, tell me about the importance of this Michael Jordan Clinic and being here in this community.
Absolutely. The Michael Jordan clinics are very important to this community, as historically they do not provide access to primary care. We've serviced over 20,000 visits within a year and a half, and we've impounded over 3,000 patients, with half of those patients that are impounded coming from the very zip codes that the clinics are in. So what that's telling us is that we're building trust and we're expanding access to where it's needed the most.
Mm-hmm. And there's 2 locations, right?
Yeah, absolutely. There's one on 1423 Greenfield Street and the one here at 416 North 30th Street.
Okay. And we're going to speak to a nurse in a little bit about the screenings and the patients that she sees every single day. But, what is the main thing that people come here for?
The main thing, just to be seen by a doctor, to start somewhere. The health journey has to start with somewhere, and just getting through the doors is the biggest part for the patients. Sometimes we may not even talk about what health issues they're having, but we're looking at their social determinants of health and things that are prohibiting them from actually coming to the doctor.
And I feel like one of the biggest challenges is just people not having any knowledge about healthcare, but you guys have an open door here.
Absolutely. We do a lot of education. We're partnering with a lot of our community partners to provide education as well. We're looking at doing some big things in the spring to kind of help. And we're also having a community day here for our own community on April the 15th that we're partnering with the community.
Oh, that's amazing. And how does it feel in your job role to be here in the community and interacting with everyone in this neighborhood?
It is a great honor, honestly, just to be able to see the difference that we make every day, and to sit back and watch patients that come through the door that are hesitant, to then now I can walk across the street at the store and they're speaking to me saying, appreciate you being here. So it has been a huge honor.
Wow, thank you so much for everything you do for this community and the clinic.
Absolutely.
And now we're going to go over to Jasmine, the nurse practitioner who sees these patients every single day, and tell us about the specific screenings that you have here.
Absolutely.
I'm here with Jasmine, a nurse practitioner here, and now a big focus of the Michael Jordan Family Clinic is preventive health care. So what are the certain screenings that you offer your patients?
That's a great question. Thank you for asking that. So some of the main preventative screenings that we offer primarily are mammograms. We like to screen patients for diabetes. We like to screen patients for cholesterol so that we can determine what their risk of developing cardiovascular heart disease is. One of the more important screenings that we do is also social determinants of health. So those are some of the non-physical factors that also play a really big part in patients' health. Some of those include screening for food insecurity. We're screening patients for financial difficulties, things such as transportation issues, mental health conditions, and just some of the other factors that affect their ability to be able to manage their care.
Now, what has been the response since opening from the community?
The response has been overwhelming. Everyone that comes in, they're just so happy and excited that we're here. I hear lots of patients say that they've waited months, to get an appointment, to find somewhere that accepted their insurance, for them to be able to come back in and get restarted on a path of wellness.
And how have you been feeling since being here? What has been, your reaction with these patients and working with them?
It's been exciting. It's been very rewarding to, just have a place for them to be able to come so that they know that their care is important, that they are welcomed here. I also enjoy being able to empower patients, just to help them see what things they can do, help them to understand the things that are within their control for them to be able to better their health as well.
Now tell me about your team and how you guys all work together with your patients.
Okay, so we have a very great team here at the Michael Jordan Clinic that consists of myself, also Dr. Shelby Stoneking. We have lovely medical assistants who are here every day to welcome our patients with kindness, with warmth. We have an amazing referrals team, awesome clinic administrator, Nicholas Green, and then we have a front desk staff that's always available to assist patients with any of those extra needs that aren't discussed during their visit. So it's amazing to be a part of a team that is committed to serving patients in this community so that they know they're always welcome to come back so that we can continue to help them on their health journey.
Well, the community is lucky to have you all.
Thank you.
Welcome, I'm Lauren Schuster, and I'm joined by Dr. Rock McCarthy of the Columbus Regional Hospital. Now, doctor, tell us a little bit about who you are, your specialty, and where you practice.
Sure, my name is Rock McCarthy. I'm a board-certified urologist. My practice is in Leland, North Carolina, and I specialize in robotic surgery.
And now, we know that a lot of your patients, they deal with prostate cancer, correct?
Yes. When you look at southeastern North Carolina, it has the second highest incidence of prostate cancer in the world, and we see a tremendous amount of prostate cancer, so it's something that we are very familiar with and can take really good care of patients from the initial presentation of something like an elevated PSA, which may mean someone might be at risk for prostate cancer, all the way up to completion of diagnosis and treatment.
And now, why should someone who is battling this disease come see you?
Sure, so for the last 17 years, I've been in this area. I've seen 6,000 prostate cancer patients. I was one of the ones who helped develop the robotics program for several years now. We've performed almost 3,000 robotic surgeries in the area locally. But more importantly, my job is to have a very good relationship and explain things to patients so they fully understand what the disease process is and help them make good decisions.
And now, is this a new technology? I feel like a lot of people don't know a lot about robotics and how it can ultimately help their health down the road.
Yeah, urology is one of the fields that was on the forefront of robotic surgery. When you look at certain specialties where technology really helps them advance the care, urology has always been a big player in that. And robotics, the one everyone thinks of is the intuitive surgical. One has had several advancements over the years. So it allows us, if we are performing surgery on people, to make much more precise movements, decrease blood loss, smaller incisions, and hopefully get people out of the hospital and back to their regular activities quicker. So when you look at the data, somewhere between 1 in 6 and 1 in 8 men will eventually be diagnosed with prostate cancer in their lifetime. And when you look at prostate cancer, I always tell people is it can mean drastically different things to everyone based upon the age of the patient, their health status, other comorbidities that they have, as well as how aggressive the cancer is. And that can vary from someone who can have a very indolent form in which we can watch them very closely, to some people who can have very aggressive forms of the prostate cancer.
And now, what made you realize this is something that this world needed, this advanced technology?
Yeah, so, I think like a lot of things, when things are being developed, they're not always meant for that particular thing. Like the robotic stuff was really developed for the Army, and it really wasn't practical to go out and do robotic surgery in the field. And then eventually Intuitive took over and developed it, and urology was just one of the specialties where it really fit into the paradigm of treatment for patients. I've been involved with robotics for about 20 years now, and if you look at when the first robotic surgery was done, I think it was 1998, even the advancements in the type of robots that we use have advanced significantly. I think this is the 6th generation of the new console and machine that I've had a chance to work on.
Mm-hmm. And I feel like when people hear about robotics, people get a little bit nervous because it is the future. But this is going to help everyone's health down the road, and I think you can help people realize that this is a good thing.
Yeah, for sure. Sometimes people think of robotics, they think of that you just go in and a machine does the work. No, this is 100% driven by the surgeon. And so you want to find people that you trust, have done a lot of it and really familiar with the technology, but there are multiple specialties now that are using this technology in the area.
Wow. And now, if someone who is watching this is interested in this and want to contact you, what is the best way to get in to see you and to see how this robotics works? Yeah,
I always think it's very important for people to ask around in the community. Who have they seen? Who do they feel comfortable with? What diagnosis they've had? It's very often that I have patients that come in really because one of their friends, neighbors, family members had dealt with the same process and has seen us and felt very comfortable from the beginning to the end with diagnosis and treatment. And so I think that's very important, is to get people that you trust to help advise you on the type of people that you need to see. And people are always asking, do we see new patients? Yeah, I think the day we stop seeing new patients is the day we don't work anymore, because constantly these diagnoses are coming along, and we need to be there for our patients for hopefully many years to come.
Amazing. And where are you located?
We're in Leland, North Carolina.
Awesome. Well, thank you so much, doctor. Appreciate your time.
Thank you.
Often on Medically Speaking, we are talking about human health, but today we are digging in and talking about the health of our furry pets at home. And now I am joined by Dr. Leva with the Eastern Carolina Veterinary Medical Center. So thank you for joining us.
Thank you so much for having me here today.
And now, you guys specialize in emergencies and specialties like neurology, which is what you focus on, correct?
Correct, yes. I am a veterinary neurologist, so we specialize in diseases that affect the brain and spinal cord. What's really unique about neurology is that we do both medicine and surgery. And some of the conditions that we commonly treat are things like seizure disorders, intervertebral disc disease, and inflammatory diseases of the brain. But we also treat unique conditions like inflammatory diseases of muscle, nerves, as well as diseases that can affect the junction between the muscles and nerves.
These are usually occurring in dogs and cats typically, correct?
Yeah, we treat predominantly dogs and cats, but neurologists will see pretty much any species that requires our care.
Wow. And now something exciting that's happening over at the medical center is you guys have a brand new MRI system. Tell me about that.
Yeah, so this has been a long time coming. Unfortunately, with everything that happened with our new building, we had some delays, but fortunately we were able to get everyone together, and our MRI machine is now safely here in our current facility. So this is just a huge opportunity for us to be able to provide this service.
Because beforehand, people had to take the trip out to places like Raleigh, and sometimes it was even hard to get into. So since having this, how has it been helping you guys at the medical center?
Oh, it's been a game changer. We see so many pets that have life-threatening neurologic emergencies, and really waiting months or traveling several hours is just not feasible for people. And so now pets are able to get seen relatively quickly and get answers sooner rather than later. And that really makes the difference. The sooner we can get a diagnosis for these pets, the sooner we can get them treated and get them feeling better. I think it's just really a huge relief for people knowing that they can bring their pet in 24/7.
And you are currently the only neurologist there, correct?
Yes, I am actually the first neurologist, so I was really excited to join the team this past fall. And, we are growing our service. We have a really wonderful team that's just really able to provide exceptional care to the community. And it's been just so fun growing our team and seeing all the wonderful things we can do here in the community.
How did you get into that?
Yeah, so I really love neurology because it's really just the perfect combination of medicine and surgery. My cousin actually has a seizure disorder, and so really seeing her struggle with that was very eye-opening for me. And that's what first drew me into neurology. And then from there, it's just such a cool specialty because we have this neurologic exam that we can do, and I can test just different nerves and segments of the brain and spinal cord. And with pretty good accuracy, I can tell you where the problem is within your dog's nervous system. And then we can take that plus their history and their breed and give the owners a list of really highly likely differential diagnoses for their pet.
And just recently getting the MRI, how often have you been using it?
Oh, right now, we've done at least 7 MRIs this last week, and our hope is to be able to do at least 3 MRIs a day. So that's, going to really help out a lot of people in the community. I'm also really excited to announce that we got an electrodiagnostics machine that should be coming this fall. And that's going to really be an awesome tool because a lot of neurologists don't have access to that. So with that machine, we'll be able to interrogate nerves and muscles for diseases that affect those different parts of the body. But one thing I'm really excited about is that it's going to allow me to test for hearing. Deafness is a really common issue. So I'm really excited to be able to offer that service.
Yeah, I actually have an experience with having a dog that went deaf, and it's sad, not being able to hear everything. And so with that machine that you guys have, what does it exactly do?
Yeah, so it's not the most perfect test, but it can tell me if they're deaf in both ears or if they're deaf in one ear. It can also help isolate where the deafness is coming from. So if it's more of a brainstem issue or more of an issue within the ear itself. And then again, from there, that leads us down the rabbit hole. Like, can we MRI them? Is there an ear issue? Is there something we can do?
So after you guys had an unfortunate event with your building not too long ago, where are you guys located now? Yeah,
so we're located at our original location on 50 Greenville Avenue. We are open 24/7, and specialty services are pretty much in the building, throughout the, weekday. Anytime that we're available, we come in on weekends, late nights, whatever we need to do so that we can get your pet feeling better sooner.
Well, this medical center is the only one in Wilmington that is open 24/7 right now. So it's safe to say that pet owners should know where you guys are located. So the address is on the screen for you. And Doctor, thank you so much for taking the time to talk to us.
Absolutely. Thank you so much for having me.
We're at Wilmington Weight Loss learning about their weight loss process and what it really takes to live a healthy lifestyle. Over the last several years, weight loss has been a hot topic. And now we are here at Wilmington Weight Loss talking about a natural remedy. And now Dr. Craig McGiffin is here with me. And now, doctor, first of all, tell me a little bit about your practice here.
Sure. We started Wilmington Weight Loss about 3 years ago. I co-founded originally Raleigh Weight Loss, and then we opened a Cary location, and now we've expanded into Wilmington. We are right now working with already about 1,000 clients.
Wow. So tell me exactly what primarily you do with your patients here. What kind of practices do you teach them?
Yeah, so basically our goal is to help folks to lose weight. The way we like to call it is lose it the right way. And what I mean by that is most of the folks that come to us are having problems with their metabolism, right? It's very difficult to take the weight off. Everything that they eat wants to be stored as fat. They can be very diligent about eating better, getting some exercise, lose a couple pounds, and then just look at a donut and gain back 4, right? So it's just an example of what we would call a stuck metabolism. And that's our goal, is to actually reset and restore that metabolism. There's 3 things that we do in order to do that. Number 1 is we have a very specific food list that we eat off of. A lot of folks don't realize that even healthy foods can still cause you to not be able to lose the weight. Sweet potatoes, avocados, peas, carrots. And once folks get the weight off, we add all of that stuff back in. It's just while you're trying to take the weight off, it makes it very difficult. And so we want to show folks like exactly what to eat and, more importantly, what to avoid. We have certified health coaches that work with folks individually to customize the process to them specifically. Because we've restored metabolism, we're losing it the right way. So we're losing fat, we're not losing muscle. Really, really important in today's world too.
And in today's world, all you see is Ozempic everywhere. And by losing it the right way, whenever they get off this program, you guys are helping them keep it off, whereas other products just jump right back on you.
Yeah, so we do offer a free 15-minute phone call before somebody starts to find out how it works and if it's a good fit for them. I do about 15 of those phone calls every day. And now over half of them are folks that have already gone through the Ozempics. They either couldn't handle the side effects, they plateaued after losing a little bit of weight, not what they wanted to. Insurance quit covering it, and all of a sudden they realized that, man, I really don't want to pay $500 to $750 every month for the rest of my life. And they realized that it's just kind of a temporary fix. When you stop, the majority of the folks gain the weight right back.
Yeah.
So to your point, once we help folks get the weight off, our program automatically works with them for 2 more months. And in those 2 months, we don't even use the amino acids anymore. It's all real food, and we show them exactly what to do to keep the weight off. Now, my favorite part, and I know you're from Chicago,
Yep.
I'm from Pittsburgh.
Okay.
There's kind of something we have in common there, which is pizza. Like, I don't know if you
Oh,
realize,
yeah,
but
deep dish.
Pittsburghers
My
love
weakness.
pizza as
Yeah.
well. And so the beauty of the program, when you get into maintenance, you only have to get it right 70% of the time and the weight stays off.
Now, do you currently work with patients who are on the weight loss injections?
Yeah, absolutely, every day. And what we find is that those folks may have plateaued, they're not quite made it to their goal yet. We're gonna help them get there. A lot of folks just wanna be able to find a way to get off of the injections and maintain their weight loss, because that's obviously the big issue. So we actually created what's called our GLP-1 off-ramp program, where we'll work with folks to either speed up their weight loss so they can hit their goal a little bit faster, or we'll work with them so that they can make the transition into really good lifestyle changes that allows them to keep the weight off permanently, and they're able to actually get off of the injections without the worry of the rebound.
Now, how would someone get in contact with you if they're interested?
Yeah, we try to make it as easy as possible. And you can either call us or you can go on our website. Either way, if you call or go on the website, you can schedule either an in-office consultation, which takes about 45 minutes to an hour. It's completely free. Or you can make it even easier and just schedule a 15-minute phone call. And that phone call will be either with myself or the other co-founder, Dr. Kevin Doyle. And we'll answer all your questions, and we'll also be able to determine if the program is a good fit for you.
Amazing. Well, everyone heard it here first. If you are looking to lose the weight and keep it off in a natural, healthy way, Wilmington Weight Loss is the place to check out and contact with Dr. Craig. So thank you.
My pleasure. Thank you.
Medicare can be confusing, and we will learn soon how timing truly matters. And we are joined by Kennette Bradley with NC Insurance Advisors, and we are talking about Medicare in general, what we need to know, and how to avoid costly mistakes. So thank you for joining us.
Thank you. I'm glad to be here.
So a really important question is, what is the age that people can sign up?
Generally, it's age 65. Unless you are disabled, you can sign up for Medicare 24 months later, and end-stage renal disease or ALS, you can sign up under 65. But generally, when somebody turns 65 or about 3 months before, they need to sign up. Now, back in the early days, everyone got Medicare Part A and Part B when they turned 65 because generally everybody started drawing Social Security. Now, if someone started drawing Social Security early, then they do get automatically signed up because that Part B has a premium and they want to deduct it from your check as soon as possible. People not drawing Social Security, when they do sign up, they get a quarterly bill for that monthly premium of Part B.
Let's get into timing, because timing is super important. And if you miss a specific date, I hear you could be penalized for life.
Yes, and some of the timing is signing up for Part B and Part D. Those are the Medicare parts that have penalties, lifetime penalties, if you don't sign up when you're initially eligible. There's some confusion when people are still working and they have group insurance. The group insurance is typically considered creditable coverage. So there will not be a Part B or D penalty if you retire later, and that gives you your special enrollment time because you're losing your group coverage.
And for people watching right now, we've been going over a lot of information here, and it could be overwhelming. So you get on Medicare at 65, or you could. When should they start thinking about this or even learning about this?
They can sign up for their Part A and their Part B 3 months ahead. Sometimes the software will let you do it more quickly. You can either do it by phone, calling Social Security. You can go to ssa.gov and sign up there. It's very simple. It just says sign up for Medicare.
Because is this 3 months before they turn 65 or
Yes.
3 months before the annual enrollment we were talking
3
about?
months before they're turning 65 if they're new to Medicare. Medicare always starts the first of the month. Sometimes people think, well, my birthday's not till the 15th. Well, it starts the first of the month unless your birthday's on the 1st. Then it
Like me.
actually starts the first of the earlier month, so you get that full month.
Good to know.
Yeah.
And for those watching still very overwhelmed, they can just come in here and talk with you about this, correct?
Of course. They can call and schedule an appointment. We do phone appointments. We do a lot of face-to-face appointments. One of my clients came in who has a Medicare Advantage plan, 0 premium. He told me that he broke his ankle. The emergency room charge was $5,475. Then there was a room and board charge for $5,064. An MRI charge for $3,587, radiology diagnostic $890, and IV $505. It just goes on. Physical therapy $492. It just goes on and on to over $28,355. This man got an infection, so he had to go back to the hospital, and he stayed 3 or 4 days. The hospital then drove him to a rehab that they probably own. Non-emergency transport. $636.30, and they went 7 miles, so they were charged $238. So $874.30. This is what has to stop. What people don't look at is what the true cost is that goes through the pipes. The Medicare Advantage plans now have, I think, about 80% of Medicare recipients. One, it's much more affordable. Two, because they're highly subsidized, you get extra benefits for dental or vision, hearing aid discounts, fitness programs. So there are a lot of things the Medicare Advantage plans do to try to help you stay well and keep you out of the emergency room.
So a big question is that people may think it's expensive to talk to you, but how much does it really cost?
Well, we do not charge. We are sharing our knowledge to help people make their best decision. And I've been doing this for 40 years, so I've seen all the changes. I was alive when Medicare came about, so I remember my grandmother getting Medicare. But no, they can call us, make an appointment, email us, go to the website, ncinsuranceadvisors.com, or they can stop in. We're here from 9 to 5.
Perfect. Well, I feel like bottom line is that learning about Medicare now could save you later.
Oh yes,
So thank you so
definitely.
much for your
You're
time.
welcome. Thank you.
As we wrap up Medically Speaking, I want to remind you that your health journey is uniquely yours. I hope this information was helpful, and we'll see you next time.
NC Insurance Advisors help North Carolinians make sense of health insurance. Real people, real answers, real support every step of the way. Call today and protect your future with confidence. Helping people since 1985.
The last time you looked in the mirror, if you didn't love what you saw, we can fix that. Hi, I'm Dr. Craig from Wilmington Weight Loss. We have an all-natural metabolic reset program that's proven to work. If you're ready to lose 10% of your total body weight in the next 6 to 8 weeks, call us today for a free 15-minute phone consultation to find out how our program works and if we're the right fit for you. It's just one phone call that could change your life.
When your pet faces an emergency, every second matters. Eastern Carolina Veterinary Medical Center is still here for you 24 hours a day, 7 days a week. Compassionate care, always here when you need us most.
I want experts on my team. I want the most advanced treatments. I want to feel like myself again.
For nationally recognized neurological care, you want Novant.